Welcome you. My name is Robin Greenfield, and I'm here at the Boise Center at the Center on Disabilities and Human Development at the University of Idaho. And I want to welcome all of you to the 6th year of our webinars. This year we are starting a series of webinars. These are sponsored by the Center on Disabilities and Human Development and the State Department of Education, and we're very, very pleased to bring these to you. A little bit different format for those of you that have followed us all these years. We used to have 4 different webinars throughout the year, and now we've changed the format so that you can get some credit. And to do that, we have created the different series that will happen throughout the year. You can take these for free, or you can get, as Carrie was saying, a credit for participating in all 3 of the series. So I'm very pleased today with our presenter and this presentation. Dinah Riley is a physical therapist who has worked here in the Boise School District for the past 20 years. She received her doctorate and did her graduate work at the University of Oregon, and has done a lot of good work since then. She was the presenter at my Summer Institute, which I always have, and I know some of you have attended over the years, and it was so well received that that is one of the reasons that this is happening today, is that the information was so great that we talked about doing it for teachers and trying to get the information to people across the state and outside of the state. So I think you're in for a treat for these next 3 sessions, and these are things that are not often talked about, these areas of executive functioning and attention and posture, but they are absolutely critical to the outcomes for children and adults. So with that, I will turn over the mic to Dinah.
Okay, thank you, Robin. I'm going to I think it's always important to acknowledge the help that I had putting this together. I have several films of children, and I appreciate the parents' permission and the children's permission for allowing me to film them, because it really has helped demonstrate some of the concepts I'll be talking about. And anytime a presenter is presenting information, it's important to really understand their perspective. And like Robin said, I am a clinician at heart. I've been a clinician for 40 years, but I also then had an opportunity to do some research at the University of Oregon. So I'm also coming from some of a research perspective. Before we start, I want to just kind of review the handouts. You will need to have printed at least the Stroop task answers. So make sure you have that printed, or at least access to that on your computer. The Stroop task itself, I will be running through this program, so you do not need to have that printed out. There's a bibliography, and it has a lot of the research that I will be talking about, or at least mentioning. And there's an area where there's books. And a lot of those books have consolidated research, and I've used them thoroughly. So let's go to why my personal goal on this, for doing this. And it really is to provide educators and colleagues with information that I've learned through research, and applying this information in my job. What I have found when I was at the University of Oregon was that there is such an abundance of information and research that isn't really out there in public, or isn't really known. And it's sad, because I think it can be very functional for us as teachers and clinicians working with children. The reason I went to University of Oregon is that in my My last years of working in the Boise School District, probably mid-year, like 10 years into the district, I had started noticing a lot of children with ADHD having similar problems to also what you would call a clumsy child. So many of these children were tripping over their own feet on the playground. I've even had teachers tell me they were falling out of chairs, and yet they were also diagnosed with ADHD. So my question was, is there something going on between the posture control and a lack of attention? And so I was looking through colleges when I decided to go on and get my doctorate with that in mind. And I discovered University of Oregon and discovered that not only do they have some of the top researchers in motor control, but they also have some of the top researchers in attention. So that was one of the reasons why I chose the University of Oregon. So I started with an inquiry and went into the research. And this is what I'm going to present today, is the research through this series. And so what happens to research? A lot of times it gets consolidated and somebody writes a book. But what is missing many times is the application. So series 3 of this whole presentation will be about application. So let's get on to the objectives of this whole series. So we're going to go from a dynamical systems perspective, and I will be talking about what I mean by dynamical systems. But first, I want you to gain an understanding of the child in a multitask-based context. So, but based on the knowledge of development and posture control and executive attention. So we want to see what happens to the child in a dual task or multitask situation when they're given 2 tasks to perform simultaneously. And one of them is a posture control task. The other one is what happens to children that have disabilities or deficits in area of attention or even posture control when they're in a dual task situation or a multitask situation. And from this knowledge, we will gain and hopefully gain an understanding of how to apply this knowledge. But the objectives of this series that I'm doing today is really understanding what do we mean, first of all, by dynamical systems. Second of all, we want to gain knowledge in the various functions of both postural control and attention, and also their development. So in order to understand the rest of my research, really these are concepts that are really important to understand what I mean when I talk about executive function of attention and what I mean when I talk about posture control. So let's start with dynamical systems, the framework. So what I learned there at University of Oregon is that this seems to be the new framework for understanding many behaviors, including motor control. And so let's look at, I'm very visual, so I've come up with a diagram. So let's look at what we mean by dynamical systems. So first of all, it's self-organizing. Behaviors emerge from the interactions of the individual systems within a context, meaning within the environment and the task that you're asking a child to do. So instead of a behavior emerging because of maturation only, we also look at the influence that environment and the task that we're asking the child, their influence on this developing systems. So throughout our talk today, we're going to go back to the dynamical systems theory and framework. So what else is part of the dynamical systems principle? So one of the things about dynamical systems principle is that, and you can see it in development, is that development just does not happen in a linear one-to-one correspondence. A little change in some system means a little change in behavior. But what we really see happening is we see a little change in a system like a nervous system. We may see a huge jump to a whole nother level of behavior, or we may see a completely different behavior that will then plateau and stay stable until something else changes. It can even be the environment. But it happens in like more of a stair-step pattern. And if anybody's ever had a child, a baby, and within 2 weeks knows what I'm talking about, that baby will change within 2 weeks to a month, and then 2 months you'll see huge leaps and bounds in development. The other aspect of dynamical systems is that variability, and you want to see variability because it means that the system is starting to change. And when there is a change, there is an instability, and you see the child maybe will do something one day and the next day is not doing it, and then the next day does it, and then the next day doesn't do it. So you see this variability occur within development, which is a good thing because it means that that child is going through transition until he reaches another higher level of development. So let's look at posture control and what we mean by posture control. So normally when people say posture, they think of alignment. Stand up straight, tuck your butt in, don't bend over. So we often think of alignment and just standing up straight or sitting straight. But there's a lot more to posture control. It's really a much more complex function than that. And let's see what it does. So really, posture control, any movement we do has to have a foundation or a postural control component. So there's basically two functions that posture control will provide. One, it provides just stability for that upright posture, whether you're sitting or standing. And it also helps you regain balance when you lose it. But it also prepares the body for movement. In other words, and we're going to show some pictures here pretty soon, it prepares the body for when you're going to throw a ball, so that when you throw a ball, you don't also lose your balance. So it anticipates what's going to happen when you throw that ball, and it prepares the body for that instability. So what we see here is just some examples of the functions of posture control. So we have orientation to task. It aligns all the body parts to have the pole vaulter go over the bar, or the high jumper go over the bar. In the anticipatory, it allows the kickboxing to stabilize their body before they move their feet. And here's another one of stability. She has to really know where her body is in relationship to her base of support. Otherwise, she'll fall on the beam. So those are just a few examples of the functions of posture control. So my study is dealing with posture control in stance, mainly because for walking or reaching, the upright posture is the most important part of posture control before you can even move. You better balance within gravity. So let's look at some of the terminology that you will be hearing throughout this presentation. So posture stability, and that's often what we think of in balance. So it is the ability to maintain your center of gravity within your base of support. So in the stance position, your base of support is really your borders of your feet. So what do we mean by center of gravity? Center of gravity is let's say, that is the layman's term for center of mass. A biomechanist would call it center of mass. And that is the point where the top part of your body is balanced with the bottom half of your body. So if you were to lie down and you would look at a balancing point between your top half and your bottom half, that balancing point would probably be around your waistline. So that's your center of gravity. That's where the center of your mass is. So in the stance, what the purpose of the posture control then is to maintain that center of gravity over the base of support. So postural sway, and you're going to hear me talk a lot about postural sway, and you're going to be demonstrating that yourselves through this presentation. It's the movement of the whole body over the base of support. So when you're standing, even though you may not be aware, your body is swaying forward and backward and sometimes side to side. And the more you sway, the faster you sway, the less stable your stance. In other words, posture control isn't working if you're doing a lot of swaying. The same is true if you sway way out towards the feet or you sway back towards the heel. That posture control system is not working. Also, if you just are constantly swaying, you're increasing your frequency of swaying, the less stable you are. So postural sway is a measure of postural stability, which is a measure of how good your postural control system is. So we're going to have you stand. We're going to have you stand right now, and I want you to stand up next to a table or a wall in case you need your arms for balance. And stand with your feet shoulder width apart. So what I want you to do is when you're standing is sway forward and back over your feet just to feel a sway. Now sway side to side. Now test how far you can sway forward before you have to take a step. Now that is your limit of stability. If you have to change your base of support in order to regain your balance, then you've gone beyond your limit of stability. And the same is true for going backwards. Now, I'm going to ask some questions here, and we'll see if you guys can write in a Q&A, write in an answer. So here's my question. Which direction, forward or backwards, did you lose your stability the quickest? So go ahead and write the answer. Was it forward or backward? Okay. Thank you guys for doing that. I know you're out there now. Okay, backwards. Exactly. Why is that? Because if you look at where the ankle is attached to the foot, you got a nice lever arm in the front, but you don't have much of a lever arm in the back. All you have is a very short heel. So of course, swaying forward, you have more stability limits than swaying backwards. So how far can you move side to side? And if you do that, is the hip or the ankle in control? So move side to side and just let me know if you feel the control from your hip or your ankle. Okay, 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 good. So with your feet shoulder width, that control from side to side is mostly from the hip. That center of mass has a long ways to move from one hip to the other, or from one leg to the other. So that is your hip that is in control from the side to side. So I want you to just get a feel of your stability limits and kind of which muscles are kind of controlling that movement. Okay, you guys, great job. So you can stay standing if you want, or you can sit down, but this is a picture of what it looks like. So what researchers and biomechanists are saying is that when we stand and sway, when we go forward and backward, it's like an inverted pendulum with the weight at the top, our head and our center of mass, and our base of support is at the pivot point. Our ankle is the pivot point over the base of support, which is the foot. So for adults, adults can actually travel 55 to 80% of their foot length before they lose their balance either forward or backward. So that's pretty good. That's a pretty good stability limit in the standing position. So so we've discussed that. Okay, let's look at the side-to-side movement. So we talked about the hip in the wide stance is side to side, but let's look at the narrow base of support and what happens in a narrower base of support. So let's bring your feet together and let's have you sway forward and back, and let's say sway side to side. Now with your feet together in what we call narrow stance, let me know, do you feel the controlled movement more in your hip or ankle? Just write it in. Good. Right. Thank you for thank you for doing this. Okay, right. Most of you wrote ankle. Right. So as we narrow our base of support, the task becomes a little bit more difficult because we've decreased our posture, our stability limits, and now we're controlling clear from the ankle instead of the hip, which is closest to the center of mass. So it becomes a little less stable. So and I think I just answered my next question, which stance configuration has the least limits of stability in the side to side? So we just said it's the narrow. Okay, so these are the things that are kind of important to understand, and that as we narrow our base of support, change our base of support, we also change the difficulty of the postural control task. Okay. Okay, so this is what we just did. All right, so how do we measure postural sway? Now you can look at someone and you can see the sway, but what is normally done in research is that they use what we call force platforms, and they measure the forces that you stand on, and they track where those forces go as you move. So it's called center of pressure, and it's a calculated point. So it's not a real point of pressure. It's calculated from all the pressures that you put on the force plate. So the center of pressure, let's say you're standing with your weight evenly distributed between your two legs. The center of that pressure would be what? Would be between your feet. So it's calculated from the forces between 2 feet. So it also, when you were standing and you moved forward and back, that is the pressure you feel is what is measured. So the outcomes of this sway is velocity and the range of sway. How far towards your stability limits do you go? And the total distance in a set amount of time. If you're constantly swaying in like 20 seconds, you've traveled quite a bit. And then, of course, this frequency of sway. So when you read an article on postural sway, these are going to be the outcomes that we'll be talking about too in Series 2. So this is our force platform. And so the forces he's standing on a force platform, and that's and the forces are measured at the corners of each one. So each force plate has forces measured at each of the corner, so that then they track the movement of the forces that you put on the plate. So let's look at what happens in development with the postural sway. So research has shown that as children age, their postural sway decreases, both in the excursion, or how far out towards their stability limits they go, or in the speed. So that means that children as a whole are less stable in standing compared to adults. And research has also showed that younger children are less stable compared to older children. And postural sway really doesn't reach adult-like movement until 7 years of age. And some researchers have shown up to 10 years of age. So maturity-wise, postural control-wise, in stance, we're talking between 7 and 10 years of age before it is really fully mature. And we're now going to look at why is this so? Why is there's such a delay in the maturation of this postural control system? So let's look at the postural control system and what systems actually influence postural control. We're going to be looking at a musculoskeletal system, the central nervous system, neuromuscular system. What my study is going to show in Series 2 is the cognitive system and how that contributes to postural control. We're going to look at sensory systems and then how we use our sensory inputs to control posture. So this is all a part of that dynamical system. And even though we're going to talk about them as individual, you've got to remember they're interacting and interrelated. So the neuromuscular system, by neuromuscular system, we mean the muscles and the nerves that activate the muscles. So we're basically going to be talking about muscular activation. So first we're going to talk about what we mean by postural tone, and a lot of you teachers have probably heard OTs or PTs talk about low tone or high tone or poor muscle tone. Well, a lot of what we're talking about is the postural muscle tone. So when we stand, and we stand with our line of gravity running in front of the ankle, front of the knee, through the hip, and behind the ear, when that line of gravity is really close to all those joints, there's very little need to have all of the muscles work. So these are some of the muscles that you'll see working, and they work constantly to keep that body within that line of gravity. Because when you stand in the line of gravity and your muscles tone, these are the muscles that are working, it's a lot less energy requirement. So why don't you stand now and concentrate on just having your ankles and your knees straight, or your knees straight, your hips straight, and standing as straight as you can. Now I want you to try and bend at the knees and bend a little at the hips. Now I want a show of hands who experienced an increase in muscle output when they stood in this, what we call, crouch position. So just give me a show of hands. All you have to do is hit the little hand button up there at the top icon. Okay, good. Yes, yes. Oh, I know you guys are doing this. This is great. Okay, so yes. So when we are out of alignment, muscular energy is a lot more. So it's really important to have good postural muscle tone that keeps us in this upright position with less energy from the muscles. But we know that we don't stand perfectly still. And we've been talking about postural sway. So when you stand, there's always this little bit of sway that goes forward and backward and a little side to side. So we're going to talk about forward and backward muscles. So it's called the sway synergy. And really what we mean by synergy is that it's a set of muscles that work together to reduce this postural sway. So what we're talking about is postural control, reducing postural sway, and it depends a lot on how well these muscles are working. So how are they activated? They're activated through a stretch to the muscles. So when you stand, and we're gonna have you guys demonstrate this. In fact, why don't you stand now? So as you're standing upright, your knees are straight, hips are straight, you're lined over your base of support, you have a nice normal stance. So when you go forward, so when you go backward, do you feel, you should feel the front muscles of your shin work, then your quads, and then your abdominals. So what we see is a synergy where these muscles are working together to keep you from falling backwards. So as you sway back, you first get the lower leg muscles because it's activated first because of the stretch to the ankle. Then you get the quad, and then you get the abdominals. And that brings you back to center, okay? So what researchers have found is that in adults, this is within 90 milliseconds, this whole procedure starts. So milliseconds, that is pretty quickly. So what happens then when you sway forward? So the opposite happens. So your gastroc, your calf muscle, your big muscles in the back of your leg, calf muscles, start activating, then your hamstrings, and then your paraspinals, your muscles of your back. And they do it in this order. So again, it's pretty quickly when you sway forward that those muscles begin. So they're tightly coupled. These muscles are in a synergy to keep that sway in line so that you don't sway too far forward or too far backward. So that is really the neuromuscular aspect of postural control. So how do these muscles develop? So what researchers have done is, because they wanted to look at postural control and what about posture control underlies experience of walking. What underlies walking? What underlies jumping? So what they did was they took children, not so much according to age, but according to level of experience. So they found that children that are just learning to pull to stand don't have these neuromuscular synergies. They do not have the sway energy. There is no organization or pattern. But by 7 to 9 months, when they've had the experience of pulling to stand, and some of them are actually cruising along furniture, you will see the ankle muscles. They will start to contract, but not the rest of the synergy. But by 12 to 15 months, you will see babies, when they're starting to just stand and let go of that support of their upper extremities, you'll start to see this timing. And they'll start with the ankle. Let's say they sway forward. They'll start with the calf muscle, hamstring, and then back muscles. And you'll actually see them start to oscillate back and forth. And you've seen a baby learning to walk. They just stand there and oscillate until they take a step. So their whole postural control system is learning what is midline, is learning what is stable at this point. But this postural sway continues up until, again, 7 to 10 years. So the neuromuscular, now we've looked at how the neuromuscular strategies and sway, control of sway has developed. Now we're going to go on to another system that influences postural control. And that is the musculoskeletal. And by musculoskeletal, I'm talking about the joints and the muscles, tendons, ligaments, cartilage, fascia, all the things that make up a skeleton and things that support the skeleton, basically. So, posture alignment, we've already talked about posture alignment. How important is posture alignment? That is influenced by range of motion at the joints. So if you're limited in range of motion at the ankle, that's going to limit what's going on at the knee, at the hip, and eventually what you're going to do to compensate in the trunk and the head. So range of motion becomes very important in keeping, again, that line of gravity within all of your joints. Okay? So let's look at what happens in development. Now, first of all, we know that babies, when they're born, and you can see these little babies, at 1 month, they have this huge, a big head and a big trunk, but their little pelvis and your little legs are much smaller. So what does that mean? That means their center of mass, remember we talked about the center of mass and being the midpoint of where your weight is really higher. So it's more in the thoracic area, above the lumbar area, so much more towards your rib cage than it is towards your low back. So by a year, it has dropped, but still, if you look at this little guy at a year, he still has a bigger head and a bigger body than his little legs. So the center of gravity still is a lot higher. But what does that mean from a biomechanic point of view? So if you look over here at the two green dots with the T in it, and you see the angle of line, if you were to sway 10 degrees, so let's say that the horizontal line is your base of support and your body is the vertical line. If you were to sway 10 degrees, when you have a lower center of gravity, you're still kind of over your base of support. So if you drop a line from the first circle down to the base of support, you see that you're still within the limits of stability. But if you have a higher center of gravity, you drop a line from there, you're over your base of support. So it becomes a lot harder to control a center of gravity if it's higher. And this is what happens with our little kids until they develop a more mature skeleton. So this gets to also, and I'm throwing this in, when you add a backpack to a little guy that's 3 years old who still has a fairly high center of gravity, and I've seen these little guys in preschools, sometimes their head and their trunk are still bigger than their legs, but then you add a backpack, what are you doing? You're raising their center of gravity even higher. So look at, if you were to take that second dot, raise it higher, then you're way over your center, your base of support, and that makes it even harder for the postural control system to keep that balance. So that's just something to keep in mind whenever you put a weight on a little guy, whether it's a backpack or a weighted vest. It's something to consider, that it makes postural control a little bit more difficult. Okay, so let's move on. So what other things that are developing? So when a baby is first learning to walk or stand, they have a slight flexion of the hip. So what happens is they have a slight lean forward. And what that does, look what that does, the yellow line is their line of gravity. And what that does is it forces them to use their back muscles a lot of the time to keep that upright position. So that's why you often see little babies walking with their hands up and their shoulder blades back, is that they're trying to keep that line of gravity over their hips so they don't fall forward. So that changes. So it makes the postural control system, it puts a lot of difficulty on that. Let's see what else is happening. So what else is happening is the arches of the foot are not developed in these really young children. And so what happens is USUI demonstrated that children put most of their weight on their heels because They're thrown back because they do not have the arches that would bring them forward. But we saw when we were doing our backward sway that our limits of stability backward is very minimal. So if you have a child that is constantly standing on their heel, they're always there in their limit of stability. So that's something else to consider. And so constantly swaying to try and not fall backwards. So let's talk about another system. So how is this controlled? How are all these muscles controlling our skeleton? I mean, how does sway come about? It comes about by control from the central nervous system, and by that we mean the brain, spinal cord, and in the brain we mean cortical areas and subcortical areas. So let's talk about how they do that. So what the central nervous system depends on is like what we would depend on if we're traveling to a city we don't know about, is a road map, and where the one-way streets are and where they aren't. So something similar to the central nervous system uses what we call a body schema. And really, for the upright posture, there are internal rules for controlling posture. So we saw that some of the rules already, that when you sway forward, those back muscles work. When you sway back, the front muscles work. So there seems to be some rules to stability within gravity. So how does this body schema form? I mean, how does that work? So we know that there is some genetic timeline to the formation of the body schema. Research has shown that it emerges at certain periods of time. But also, if you go from the dynamical systems perspective, we know that a lot of it is learned from sensory motor experiences. So as the baby goes from rolling to belly crawling, to crawling on all fours, to kneel stand, to pull to stand, and to walking, he's constantly experiencing sensory motor experiences. So let's look at how do these happen. So when this body schema is formed, it has three representations of the body that is provided by sensory systems. So in order for the body schema to develop, these three representations have to be very, very accurate on telling the central nervous system where the body is in space, what is the position of each of the body parts in relationship to each other, and what is the relationship of the body to the support surface. So there are three necessary information that needs to happen before a body schema is accurate. And so what we're going to do now is look at these sensory systems that provide this feedback to the postural control system using the, to the body schema, so that the postural control system, the central nervous system, can use these sensory systems. So the first one we're going to be talking about is somatosensory, and that includes receptors of the skin, joints, tendons, muscles, that provide the central nervous system feedback as to the position of the head, trunk, limb in relation to each other and to the support surface. So basically, they're what gives us not only our body geometry, but our relationship to the support surface. So they're very important. And in tactile, we usually talk about the deep pressure, the mechanoreceptors, that when you swayed forward, you felt pressure in your toes. When you swayed back, you felt the pressure in your heel. So it wasn't just the ankle muscles that were being activated, but also you've got the deep pressure from the bottom of your feet. The vestibular system is located in the inner ear, and it are receptors and they give position and movement of head in space and within the gravitational field. Now I say head in space because it's the vestibular system plus the neck, muscles of the neck that give us the whole body. Because if you were just to move your head, you wouldn't know if your head was moving or your body was moving unless you knew the position of what your neck was doing. So the neck proprioceptors are very important along with the vestibular system to let us know what our whole body is doing in space. The visual system, again, lets us know movement. It indicates position and movement of the head in space and distance and location of objects in relationship to the body. So these are the three sensory systems we're going to be talking about that form our body schema that the central nervous system uses to activate those neuromuscular responses. So, as we see a baby that goes from newborn to standing and cruising, if you look at all the stages he goes through, that body schema is constantly changing according to the child's body size, musculoskeletal system, his muscles, and his sensory system. So how does this happen? How does this body schema form? And quickly, because this happens within a year's time. So research, and this is all based on research, the postural, the body schema develops and postural control develops from the head to the toes. So first, you see a baby working really hard to get that head upright in gravity. But before that happens, what researchers have shown is that there is a tonic neck flexor activity. In other words, the muscles in the front of the neck are constantly active. And that makes sense because a baby is usually in that flexor position with his feet and hips and everything flexed up and his arms flexed and his head flexed just so he can fit in the womb. So you have this tonic neck flexor activity prior to head control. But within 10 weeks, we have organized muscle responses. So by organized, we mean if the head goes forward, then the muscles of the back of the neck activate to bring the head back. If the head falls backwards, the muscles of the front of the neck activate to bring the head up. And there's this constant, and you've seen babies do it, constant work on getting that head upright. But that occurs 10 weeks from birth. So what is the sensory system that maps to this? Well, what they have found is that babies use a lot of vision to right their head. So somatosensory and vestibular have already started working in the womb. But vision then comes in to emphasize that gravitational position. And babies start to learn to depend more on vision. They get a stronger response of head control when they use their vision. Okay, so from sitting, so this is all on research. This is what research has shown. So how does that go down to, let's say, sitting? So what are some of the rules for sitting? So what they have found is that vision also is important for learning to sit. So in sitting, if you were to sit a 2-month-old, again, there is no organized neuromuscular response. But by 3 to 5 months, again, an organized neuromuscular response of the head and trunk begin. And vision is what helps control that. And that's what infants, when they're learning to sit, depend on that vision. But experienced sitters, so by the time a child is sitting, and usually experienced sitters are ones that get into that position through the crawling position. That's the way babies get in position of sitting, is from crawling. And they often, you can see them go from crawling to sitting and sitting to crawling and reaching and sitting and crawling back to sitting. So babies do not come straight up from supine position or laying on their back, and they do not come straight up to sit. They start from an all fours position, and that's really important to understand because a lot happens in that all fours position to posture control and preparing the baby's muscles for that sitting position. And unfortunately, research is not very strong in this area of development. It goes straight from head control to sitting to stand, but there's not a lot of information or research done in the all fours position. So by 8 months, the child will be able to sit, but guess what becomes then more important is the somatosensory. Somatosensory then becomes more important because it's the relationship to the support surface. Just like in the ankle, when you're standing, that ankle activates first because of the relationship of your foot to the support surface. The same happens because the relationship of the lower extremities, the butts and the legs, to the support surface in sitting, that somatosensory system again becomes very important. And so activation of your neuromuscular sway in sitting again begins at the hips and then moves up. So we see again a little bit of a pattern that organization comes much later with experience, and that vision seems to be very important in putting this together. Okay, so let's go on. I think what I'm going to do, I see there's some questions, and what I'm going to do is right towards the end, I'm going to answer some of these Q&As because we're going to have a place for questions and answers. And I see several of you have written. So I am going to be answering those questions at the end of this. And we're also going to open up some phone lines for people that want to ask questions. So if you hold off for just a little bit, we're almost finished here. And I will then go back and answer some of those questions. So here's a picture of a 7.5-month-old, and if you look at the line of gravity, it goes right from the hip joint to the shoulder joint and just a little bit in front of the ear. So he is probably using less muscles to keep there than look at the 5-month-old. Now that 5-month-old has good head and upper trunk support, but look at that lower trunk. That baby is not ready for sitting. That baby can be propped, but the baby's not ready for sitting on his own. So this baby at 7.5 months was crawling everywhere, and that prepared those nice back muscles for this sitting position. And he's able to go in and out of that position. In this position at 7.5 months, he frees up his arms for exploration of objects. So this is why it's so important to have this position and to have this stability, is that it frees up the arms. Instead of the baby propping himself, his arms are free for further exploration. So if we were to draw a schematic picture of what we've been talking about, we see that postural control is the foundation of further perceptual motor and perception and action movements, and that is the basis for higher level skill. So if you have a child having trouble with throwing a ball, instead of looking at the skill and practicing the skill, we often go further down the pyramid and maybe look at the postural control. Does he have stability enough? Can he anticipate the destabilization that throwing will cause? So instead of practicing throwing with a body that keeps losing his balance, we may want to look on postural control. But underlying postural control is what we've talked about, body schema. So postural control really depends on that accurate body schema that is provided by all those multi-sensory systems, the three systems that we talked about. And how do those three systems get to be mapped to the motor is through your early sensory motor experiences, both pre and postnatal. Now that with our wonderful ultrasound imaging, they're finding that the baby in the womb is doing so much work with kicking and moving that he's developing a lot of tactile, proprioceptive, and vestibular inputs. And these now then can be used postnatally to help him go against gravity. So these early sensory motor experiences are very important in formation of a good body schema, which then is important for postural control and on and on. So let's move on because I see we're running into some time here. So how are we've talked about mapping vision into early sitters, early head control and early sitters. What happens to sensory strategies for those standing? So researchers have done a lot of manipulation of the environment. So if you look at number 1, that's standing with normal vision. The support surface is normal. But if you go to 2, what happens to the sway when we do vision? So vestibular, the person still has vestibular and somatosensory input, but he has no vision. So what happens to their sway? If they sway a lot, that means they are probably depending on vision. So what happens is they do 6 different conditions. So number 3 is what happens is they move a room or they move a visual surround and make it look like you're moving when you're not, just the surround is moving. And what happens is if you depend on vision again, you will move according to the room. So and number 4 is they put foam underneath and take away the somatosensory. So the somatosensory is inaccurate. And what they have is vestibular vision. So it goes on and on. So if they take away the support surface, your relationship to the support surface, and they take away a vision, all you have left is vestibular. And number 5 and number 6 are the most debilitating. In other words, that even in adults, that's where we see the most sway, is when they take away the vision and the support surface. This is how they test for sensory strategies. Let's see what happens when in the development. So we've already talked about that adults depend on somatosensory input. But before the age of 4, children learning to stand depend a lot on vision, all the way up into 4 years of age. It's the dominant vision that they weigh to know where they are in posture control, or know where their body is in relationship to the space. So 4 to 6 years is when they're starting to depend more on somatosensory, in other words, the relationship to their support surface. And what is happening in this transition is we see a lot of variability, because some days it goes from vision to somatosensory. So remember our dynamics theory. Remember what we talked about is variability is sometimes a hallmark for this transition. So 4 to 6 year olds will often see a lot more sway than you might even in a 3-year-old or a 8-year-old, simply because they're transitioning on what type of sensory system should I use. So we're going to see a 4-year-old here pretty soon. So by 7 and sometimes 7 to 10, you get a continued development of weighting the somatosensory and letting vision do other things and weigh what's happening at the foot and at the ankle. So we're going to watch a video, and I'm going to have Ben pull it up and we're going to look at a 4-year-old. Okay, this is a baseline. So no vision and hard surface. So this is where I'm going to blindfold him. Now look at him going backwards, going forward. So we have a little bit more sway. And what I noticed with this little one, whoa, there's a sway. There's good. So as you see, he's 4. So he probably still has some dependence on vision. So this is vision and the soft surface. So I'm taking away his relationship to the floor. So he doesn't have as much pressure or input from his feet that he does, yeah. And he wants to make sure I am back there. Okay, so this is no vision and soft surface. So this is the hardest for him. He is really swaying. I've taken away, the only thing that he's depending on right now is vestibular. Whoa, he's going backwards. Yeah, that is not comfortable for him. So this is the hardest one for him. So this is a test to see what kids use as their sensory strategy. So I guess we can pull back the okay. So let's look. Let's just kind of put it all together in the dynamical system. So we looked at all the systems in the yellow. If you look at the yellow circle, we've put together all of the systems that contribute to the postural sway. We looked at environment, changing a lot of the visual and the support surface environment. And we looked at the different tasks required for postural control. So when we start into task analysis and applying this information, we're going to look at the posture control task. Is it one of stability, or is it one with mobility and stability? So we're going to go on and ask questions. So what I'm going to do now is I'm going to answer some of these questions. So we have a question from Natalie B. Is toe lift normal with backwards? Yes. And that is because you're using the front area of your shin muscles to bring that toe up. That's very normal. That's very normal. So those of you in a special ed class with kids with AFOs, what happens when they stand? Can they lift their toes up to keep from falling backwards in an AFO? The AFOs I've seen, many times they cannot. So that's just something to consider and think about. Okay, let's see. How does this work for kiddos with low vision? Can they rely more on auditory? So if they have low vision, what they probably weight is their somatosensory and their vestibular. So let's see. In order to call, if you want to make a call, you can press *6 to unmute. Is that right? Yeah, to make a comment or discussion. So we may just go ahead and use the question and answer box. It might be best. So if you have any questions over on this about any of the posture control or whatever, just write in your question and we'll answer that. So does everybody understand postural control and its development? because it's very important that you understand this, because when we get to the series 2, I will be talking about some of this terminology, and it's good to have that background and to understand what I'm going to be talking about. Okay, so I don't see any other questions, so we're going to move on. And we're going to talk about the attentional system. So, when normally we think of attention, we think of paying attention. When somebody says paying attention, we think of attentiveness, being alert. But the research is showing that there's a lot more involvement in the functions of attention than just staying alert. And for years, that's what attention really meant, was just being alert. But now, attention has a lot more functions than just being alert. So what I'm going to be doing this next few slides is you're going to go through this little exercise to show what attention can do. So in this first scene, what you're going to see is 2 scenes. You're going to have one scene, and then the next scene will come up very quickly. And you're going to see if there's any changes that occurred in that scene. And by changes, I don't mean that the picture jumped a little bit. There was something that changed in this scene. And I want to see if you detected a change. Okay, here we go. So get ready, because the first scene is coming up, and then I'm going to quickly turn it off to the next one. Okay, did anyone see a change from one to the other? Something in this scene changed. Okay, it did move to the right, but there's something that changed in the scene itself, not the fact that it moved. Okay, it shifted vision, but there's some object, something changed in the objects. Yeah, I'll do it again. Okay, here we go. Let's do it again. Oops. Here we go. Okay, somebody saw it. Okay, some other people saw it. Okay, okay. All right, it took a second time, didn't it? Right? Okay. Okay, so that's amazing that we didn't see it the first time. We saw it the second time. Maybe the attentiveness was at a good state. So for those that didn't see it, I'm going to guide you. So what I want you to do is orient your attention to the right side of the garage, to the right side of the garage frame, and that means your right side. So we're going to do it again, and then see if you saw the change. Okay, did you see it now? All you have to do is raise your hand, yes or no. Yes, okay, yeah. So once I guided your orientation, yes, good. Thank you guys for raising your hand. So once I guided your attention to a certain location in space, you are able to see it. And that's what researchers have seen, is that the attentional system will help orient our attention to a certain location in space, and the reason behind that is so that we can process stimuli faster. Okay, so we're going to get further into that a little bit. So back in the 1900s, William James, who's been called the father of psychology and is from Harvard University, had an inkling or kind of understood a little bit what we're talking about when we're talking about attention. So it's the taking possession by the mind in clear and vivid form of one out of several possible objects. So in other words, what we just did is we oriented. Focalization or concentration, so there's some focus to attention, and it implies that we inhibit some information, but in order to process other information. So there seems to be possibly three functions to attention, and it's more than just being attentive. So let's look at some of those functions. So what research has found, and what they've done this through several tests, is that there seems to be three separate neural networks that are involved with attention. And we're going to be concentrating on executive attention, like the title implies. But I think it's important to know the other functions because they're so strongly interrelated, and many times the executive function takes over or controls the other two. So it's important to understand orienting and the alert state of attention. Okay, like posture control, many things influence attention, or the development of attention. So we're going to look at how language can influence attention, how sensory motor systems can influence attention. And of course, then there's the three roles of attention and their separate neural networks. So again, attention is a system of many other interacting systems. Again, going back to dynamical systems framework, it's about the interaction of all of these systems so that attention emerges to where we have it today as adults. So how is attention measured? So in infants, researchers will just measure how long they look at something. Then they know they're focusing or attending to it. What we have, event-related potential, EEG, brainwaves. But brainwaves during, while a child is doing a function. So I'm going to just go quickly to this next one. This was taken out of the Oregon Quarterly, and it's Dr. Helen Neville has a brain development laboratory, and she's currently looking at high-risk children out of Head Start programs and looking at why they have learning disabilities, why a lot of people or children from low socioeconomic households have learning disabilities. And one of the things she's looking at is attention. And she uses a lot of these ERPs. So he's doing a function, but she's also measuring his brainwaves. So the other thing that has come on the neuroscience field is magnetic resonance imaging. That's MRIs. But what they do is they do a activity while the brain is being imaged. So what happens is they get to see what part of the brain is being used while they're doing the activity. So it's much more quantitative. It's much more of a reliable measure than they used to have. Another thing that they have done, and because of technology, is they've been able to go into animal brains while the animal, like monkeys, they train monkeys for months to do a certain activity, and then they go in there with a single little probe inside their brain, and they measure the synapse of a neuron as the animal is doing the activity. A very common one test is what we call a marker test, and you guys are going to get to do a marker test. You're going to actually do the Stroop test to demonstrate attention. So a marker task is really a specific task that is designed to examine the efficiency of the attentional networks. So we're going to have you do a Stroop task, but we also have attentional network task and a child's attentional network task that was developed by Posner, Dr. Michael Posner out of University of Oregon. So let's go talk about each of the individual functions of attention. So normally when we think of attention, we think of a state of attention, the attentiveness or the internal excitability of a system. So what they have found in research is that we have a global arousal system. So and it's on a continuum. You wake up in the morning and maybe you're You're just coming out of sleep and you're drowsy. So that is one end of the scale. The other end is that you know a test is coming up, or you're going to be doing a talk, and you get anxious. So that's the other end, or over-aroused. So what they're finding is, in order to attend, there is an optimal state of this arousal in order for attention to occur. And so the function of the alert state of attention is to get into this state of attentiveness. So that is the specific selective attention state. So one function of the alert state is to prepare the body, get the body, the nervous system, into this optimal state of arousal. So it increases the state of attentiveness in preparation for a signal to be processed. So in other words, when I said, get ready, because you're going to be seeing a change from one scene to another, a lot of you immediately became much more alert and were ready for the exercise. The other thing it does is through the executive function, that is a goal-oriented function of attention, it keeps our focus. When we are focused on something, it keeps our nervous system at the optimal level of arousal in order to do an effortful task. But by 3 months, this is the alerting network is really starting to develop at 3 months of age. And if any of you have ever had a newborn or a baby, and by 3 months of age you're holding that baby is looking at your eyes, is looking at your face, is scanning your face, and is really focusing. The amount of looking that baby's doing means that he's at that alert state, and this develops really pretty normal. But it's not really fully developed until adolescence. So I'm just going to answer this one question. The Stroop task is a lot of times given by neurologists to see where, like a lot of times with elderly, to see where there's attention is and how well that they can process or change. Well, we're going to get into the Stroop task later on, but anyway, it's the executive function of attention, and a lot of times neuropsychologists will use it with elderly just to test to see where they are with that their level of attention, especially after a stroke. Okay, let's look at what happens physiological-wise to when we're in a selective state of attention. So when we're looking like at an event, we're really looking externally at something in the environment, we're focusing on it, our heart rate lowers. But if we're trying to problem solve, our heart rate raises, it increases. But we often see reduced motor activity. There's a relaxation at the mouth and chin, and the fidgety movements have been reduced. So when you see a child completely focused, you see the mouth is open, it's relaxed. You see sometimes there's just no motor activity, and just a lot like this little gal on the right-hand side. So we've gone over the alert system and its function. So orienting. So I think a lot of you, once I was able to orient your attention from maybe the center of the scene to the right-hand side of the garage, you were able to see what changed. So part of that orienting system is that it allows us to disengage from one focus, to shift our attention, our visual attention, to another focus, and then re-engage a focus. So it's a 3-step process. And it's in a whole different area of the brain. So it starts from 0 to 2 months, it's involuntary. In other words, if you have a baby and you have a brightly colored object, that baby's eyes are going to automatically go to that brightly colored object because that is involuntary and it's from subcortical areas of the brain. But it goes from involuntary to voluntary at 6 to 9 months. So by 6 to 9 months, the baby has more control of where he wants to orient his attention. So it's a slow process in development, but by 6 to 9 months, this orienting investigative system is pretty much in place. So the ability to shift attention from internal stimuli, let's say you're thinking one thing and you're going to then all of a sudden think something else, that takes a little bit longer to develop. So that doesn't develop until fully develop until early into adolescence. So, and it's more related to goal-directed behaviors. So we're going to look at orientation. If you look at scanning and environment, because this is important, because when we get into application, this will really be important to application. So it's really good to understand this. So if we had the researchers put together 2 houses, and they wanted you to scan both houses to say if they're the same or if they're different. So let's look at the organization, and what they did was they tracked the eyes. So they had a way of tracking where the eyes went in order to scan for that. So if you look at the adult, that looks like a pretty organized scan. That adult got about every square there was in a really organized manner. But let's look at the 3-year-old. And maybe this is why we have some 3-year-olds in our preschool that have a hard time finding where they need to sit. So you look at this house, the 2 houses of the 3-year-old, I guess it's 3'11", almost 4, and he really only scans medial part of the picture. He's not scanning anything else outside in the perimeter. And his answer to this is not the same, even though it is the same. So that's just his ability at this age level in the orienting system to be able to scan his environment. Now, if you look at the 8-year-old, he's getting better, but look at how disorganized. It really is he's trying to look at all the squares, but it's very disorganized. So he says it's the same, but he says it's not the same, but it is the same. So we see that the orientation has a lot to do with scanning and the organization of scanning, and that'll be important again in application. So what do children choose to tend to? Well, a lot, again, we're talking about dynamical system, a lot depends on where our vision is in development. Now the vision really takes a long protracted time to develop. So newborns, their whole retina, the optic nerve, and even that optical cortex is not hardly developed. Well, they've been in the womb where it's been nice and dark. So newborns, the only thing that they can really see is contrast or larger images, the outside edges of images. They are not able to see the center. They see the outside. And that's because of their vision. So they attend, that's what grabs their attention, is high contrast or large images. Now, by 2 to 3 months, a child is able to see a lot more, and he likes the novelty of an object or where it's located. So again, he's getting in that orienting system that's coming in, and his eyes are able to go to a certain location in space, and the novelty of an object gets his attention. But by 3 to 9 months, when a child is able to manipulate objects, so if you remember the little baby that was sitting and he was manipulating that object, what they attend to is the graspability of that object and what they can do with that object. And that's what gets their attention. But by 9 to 12 months, not only are they still progressing in their manipulative abilities, but they're also learning to walk. And so distant objects, distant events become important, and they want to attend to those because now they can walk to them. And the other thing that's developing at this time, this is a huge time of development, is joint attention. In other words, they're looking at what their parents are looking at, so that they're focused on what others are focused on. So we're going to look at selective attention. And this is a little guy that actually is my grandson. Oops, let's see, we need to back that up here. Let me back it up. Okay, selective attention at 12 months. He's a grandson, and I'm going to stop it just a minute so that I can talk a little bit here. Oh, thought I did. Okay, I guess I can't pause it. Anyway, he got all of these toys, and with bells and whistles and switches and buttons and talking and moving. But he spent maybe 2 minutes at the most with each of those toys. His favorite toy, and you're going to see this, and I'm going to explain why it's his favorite, and it'll be pretty obvious, is it probably cost all of $1. And let's see what that is. Okay. He loved this wooden spoon. Now this wooden spoon, he could do so much with it. He could poke it. He could poke it through things. So we're going to watch him poke it. He never let go. He could carry it. He could carry it because he's just learning to walk. He couldn't carry his other toys. So this toy was special. He can put it in his mouth. He can put it behind his back. He can pound with it. And believe me, he looked for everything in the house to pound. And the last thing is, oh, and he could scrape the floor with it. And he tested the carpet with it. The different textures, that's what got his attention because of what he had. So as you can see, this is the toy he spent the most time with. Even though he had all those wonderful little switch toys, this was his favorite. And it just shows you what children select to attend to. Okay, so let's go on to the next video, because this will demonstrate joint attention. So this is a 12-month-old, again, and the parents are at an aquarium. Now watch him. He may lose his attention momentarily, but then he wants to see what everybody else is seeing. This is that joint attention. It's so important to develop that external control of attention. So this is where the parents are starting to teach the child what to attend to by attending to it themselves. Now he may lose focus, but then he usually goes back to it. Okay, so let's move on to the next. Okay, so but by 18 to 24 months, this is a huge area of development for what children attend to. Why? Because of other things that are happening, other systems that are coming into play. One of them is huge, is the development of language. So naming objects, symbolic play. So they're looking longer at toys because of maybe its symbolic significance, or it has a name to it that they can say. Or let's say they're looking also, what's developing is their self-awareness. They have a greater awareness of their behavior in relation to social standards. So those are impacting what they attend to. And the other one, besides improvement in comprehension of events, is an improvement in executive function of attention. They're able to inhibit distractions and select one toy over another. So I see some people have made some comments and they look pretty good, so we're going to again save those for later on when I start talking about executive attention. Okay. So let's talk about executive attention. And what we're talking about executive function of attention is that it's the independent control of attention. So by a year of age, we've already seen that the alerting system is in place. It's not fully developed, but it's there. And the orienting system is in place. So those early systems of attention have already developed. Now, executive function network comes in later, and that is the independent voluntary control of attention. No longer do we need to direct the child's attention to objects, but they learn to direct their attention to objects on their own. So what are some of the functions that we see in the executive function of attention? So again, they're able to, in the function of attention, we can inhibit some stimuli coming in and facilitate others, dependent upon what the goal is. So it's a very goal-directed behavior function. Again, we've talked about how it can control the amount of focus, even though the alert system is a completely different network. We have cortical control over that network through the prefrontal cortex. That's the part where this executive function of attention is, to keep that focus going. It's also important for maintaining and storing memories. Without attention, it's very difficult to retrieve anything out of a working memory. So attention is needed in that. Self-regulation is a big part of it, inhibiting those emotions for a better response, increasing our arousal, changing our thoughts. Cognitive flexibility, being able to resolve conflict between two stimuli, or switching from one stimuli to another, being able to, if two things are coming in that you need to attend to, being able to switch back and forth. So what we're going to do is look at the Stroop task as a executive function test. But the thing I want to talk about, and this is going to be really important to understand, is capacity limited. So even though this executive function of attention can do a lot, it's also limited at how much it can do at the same time. And this is where we're going to talk about the multitasking conditions. So how does that executive function work on a sensory signal? So what they have found, and this depends on what the goal of the task is that attention can actually go in, that executive function can go in, allocate attention even to where the sensory system is registered. So in other words, if I were to give you a scene of finding Waldo, so you have a picture of what Waldo is, you may not even register what else is in that scene if all you're looking at is Waldo, because that would give you a better chance of finding Waldo if everything else is inhibited because it's irrelevant. So even at the registration where you first are looking at a picture, other visual parts of that scene may not even be registered on, may be inhibited from even coming in. Or it may go as far as perceptual analysis, but that's where it stays, is just at a certain point in the processing. So anywhere in early selection or late selection, that executive function can say, you know what, I don't want vision to even look at this. I think you've probably, if you've seen this before, you know somebody that bought a new car and it's a red Prius. And you're going down the street and you know that you're in their area. And all of a sudden, you can't believe how many red Priuses there are. Because why? Because you're attending to a red Prius. Now, there may not be a lot of red Prius there, but because you're selecting to inhibit other car colors or other cars, you're only seeing a red Prius. So we have several examples of that in our life where we actually do not even see something because it's not part of our goal that we're going for. So, but the executive function gets to control that part, the sensory inputs, and how much is registered or how much is inhibited. So we are going to do a Stroop task. So what I want you to do now is find a watch with the second hand or a stopwatch, or you can use your phone. I think a lot of phones have stopwatches, and you're going to do this in a seated position. So in test one, you're going to do is you're going to say the word. Just read the word as fast as you can in a seated position. Now I'm going to pull the Stroop task up on the computer, okay, so that you can actually sit in front of your computer and do the task. So we're not going to do it yet. So you're going to sit in front of the computer, you're going to do this task and time how long it takes for you to do this task. And I want you to write this down. So we're going to do test 1 first, and then we're going to do test 2. So maximize, if you're in a group, one of you, if you can maximize your, or bring out the answers to the Stroop task, you will look at how accurate the person is too. So this first test, everybody should be pretty accurate because it's pretty easy. So let's bring up the Stroop task. There we go. Test 1. Okay, so what I want you can read the letters either across, or the words either across or down, but make sure you go through all the columns. And then when you do test 2, do it the exact same way that you did test 1. So in a seated position, I want you to look at the screen. So whenever you're ready, I'm going to give you a couple of minutes to do this. I want you to time yourself from the beginning to the end and go as fast and as quickly as you can. Okay, I'm going to give you a couple of minutes there to finish this. Okay, let's have you guys write down your reaction time. You should finish it by now, I hope. So write down your reaction times, and I'll just get an idea. Okay, so we have between 6 and 9 seconds. Yep, between 6 and 9 seconds. Good. Okay. All right. So that was test 1. Should have been fairly easy. So now we're going to go to test 2, where this is going to really test the executive function of attention. And here's why. So in this next test, test 2, you are going to be naming the color of the word. So in other words, the word will come up. It'll be written in a certain color of ink. And you are to name only the color of the ink. All right, so let's bring up test 2. Okay, and when you're ready, go. I'm going to give you a little bit, about 3 or 4 minutes with this one. So remember, not the word, but just the color of the ink. Okay. All right, I'm getting some results here. Good. Yikes. Yep. Right. Okay. So it's taken at least twice as long, and sometimes 3 times as long. Yep. Good. Okay. So what happens when something requires more attention? Here's what happens. Your reaction time, your speed of processing increases. So when this is a test of the executive function. Now, as we age, that reaction time is going to be much longer. So this is why it's often used to test the executive function of attention. But I had one comment that said, yikes, yeah, it's not easy. So we're going to go over and see what's happening during this Stroop task. So the development of executive function, let's talk a little bit about that, and we're going to talk later about how that executive function works as a model. So again, we talked about the selective attention and how that changes and what kids attend to, but why is that? That's because part of it is the executive function from 18 to 24 months takes a huge jump in development. All of a sudden, focusing has increased tremendously. Children are able to focus and maintain that focus because they can inhibit distractions. Attention can be directed with words and naming objects. So attention now can be directed externally through words. Children now are able to play with more than one toy. They can jump from one to another. They have a cognitive, what we call cognitive flexibility. And a really important aspect of the 18 to 24 months is that, again, they have, they're beginning self-regulation according to social standards, being able to read what's important socially for their behavior. So there's a big jump in the executive function at this age. So, but by 3 to 5, that independent control of what's happening with their attention is made a huge increase. So their focus continues, and what really is important is they're beginning to inhibit irrelevant stimuli and to reduce the impulsive responses. So by 3 years old, 3 to 5, this is a big change in their behavior. And we've often seen it in our little preschools, our special ed preschools, is that children that come in at 3 sometimes have a 2.5-year-old behavior. But by the time they're in 3 years, by the time they leave the program at 5, their attention has definitely increased and they're less impulsive. So, and I often wonder sometimes if some of the things that we diagnose with maybe a sensory processing problem and impulsivity is not an intentional problem of the executive attention function of attention. So it's just something to consider that it might be also an attentional problem and not a sensory processing problem. I'm not saying that sensory processing doesn't exist, but it's something to consider also is that attentional system. Okay, school age from 5 to 10, there's a huge development in the resolution of conflict between two stimuli. And the biggest development in that ability to inhibit irrelevant stimuli is between the ages of 6 and 8. So I want you to keep these numbers in your mind, and we're going to review it, but this is going to become real important when I start my research, these factors of the development of executive function. So let's look at, they did a research. This is in your bibliography, and it's actually called Attention in Early Development, not Early Development and Attention, but it's by Rothbard and Ruff, and it's an excellent book. I would recommend it to anybody that wants to further learn more about the attentional system and its development. But anyway, children were watching a puppet show for 10 minutes, and these are seconds. So the numbers you see there are seconds. So if you look at focused attention while they're watching this 10-minute puppet show, they looked at it, children 2.5 years, they looked at it 73% of the time, whereas 4.5-year-olds looked at it 92%. But look at that focused attention. So this is in seconds, maybe a minute of focused attention for the 2.5-year-olds, and by 3.5, a year later, doubled, and then even grew more by 4.5 years old. And if you look at time away from the task, they stood up and walked off. Again, at 2.5 years of age, they spent a lot of time away from the task, whereas by 3.5, just a year later, 5.8 seconds. So you see that there's a huge developmental change from 2.5 years to 1 year, or to 4 years, 4.5 years. So if you look at our little preschools and some of the little kiddos we may get when they're 3, it might be an attentional problem that improves by the time they're 4.5 years old. And the same with the free play. Huge change from 51 seconds to 9 seconds. Time away from task, or focused attention, 78 seconds to 174 seconds. So a lot is happening in this preschool age group, developing that focused attention and self-regulation. So we talked about the executive function of attention, but here is a characteristic, again, that we've talked about, is that it's limited. The capacity is limited. So let's go over each of these. So for each individual, so every individual has their own finite attentional resource for processing information. So yours may be different than mine, and mine different from a child's. So we each have our own capacity to process information in this executive function. Performing any task requiring attentional resources is given a portion of this capacity. So depending on how large your capacity is and how difficult the task is, you can perform several tasks at the same time. But if 2 tasks are performed together and they require more than the capacity, the performance on either or both deteriorates. And I know you guys have experienced this. We all multitask every day. So if you're at home and you're trying to do the dishes and you're cooking a meal, but you got the laundry going in the other room and you're packing a bag because you're going to be leaving for Washington the next day, and you're trying to do everything at once, how many of you walked into a room and you go, why the heck did I walk in this room? Because something had to give. And that was your memory of why you wanted to go into that room. So we can only do so much before some task deteriorates. But another important aspect of this is that, and I think as teachers and therapists, we really need to keep this in mind, that that a practice of a task leads to reduction in the need of attentional resources. So the practice of a task leads to the reduction in the need for attentional resources. So if you're teaching handwriting, when you teach handwriting, that little guy is going to be, or girl, is going to access that executive function big time just learning it. But practice will allow them to have it more automatic so that when they're prepared to write a sentence, then they can concentrate their executive function on what they want to say instead of how they want to write their letters. So practice, practice, practice. Very important, especially in the school system. So let's talk about that Stroop task and what's going on. So here is a model that researchers have come up with that explains a little bit of how the executive function of attention works. So here you have the executive function, or the attentional resources. This represents attentional resources, okay? That's one processing area. And there's several circuits that go into this area. You got the motor circuits, perceptual circuits, memory circuits, and then circuits that allocate attention. So let's say that and then the second processing area are those that don't require attention. They can go automatic. For instance, if the task in the Stroop test, your first test was to just read the word. So you have the word and you have the color of the word. Well, luckily they were the same, so they kind of facilitated it, and you can get a motor response. There was no need for further processing or further attention to process using other circuits in order to come up with the right answer. So the attentional requirement of that first test was very, very low, which showed in your reaction time. Your reaction times were like between 6 and 10 seconds. But let's look at what happened when we go to the second test. So immediately that became very hard. So you have, what happens is, you had to go, this whole task went in to the global workspace to be processed differently. In other words, more information needed to be attended to before you could come up with a motor response. And so what you needed to do was suppress the word and facilitate the color. So attention was needed to inhibit the word and to facilitate the color before a motor response. So that's why your reaction times were so much longer. Some of them were 25 and 30 seconds, almost double, if not triple, that of the first. So you can see that when a task requires attention, a lot is going on in this global workspace. A lot of attention is needed to further process it before a motor response can be made. So what I'm going to do now is just summarize what we've learned, and then we're going to have you ask some questions. So again, like the postural control system, we went over developing systems, how the motor system, how sensory influenced attention. We looked at language influenced development of attention. We looked at the 3 areas of attention, the three functions of attention. We looked at the environment, the importance of the sensory environment and the social environment in order for attention to emerge. And we looked at the different tasks. So Experience with the task reduces the attentional demands. So experience is important in reducing attention. And we looked at the single. We're going to be, next week, we're going to be looking at a dual task. What happens when posture control and attention are done together? And what does that look like in adults? And what does that look like in children? And what does that look like in children with cerebral palsy, who have deficits in many, many of these developing systems? So I'm going to take this opportunity to see if there's any questions, so you can write them in, and we'll see if we can answer. I know there was a, okay, you said it could be sensory or attention, but aren't they inherently combined? If not, how do you tell the difference? So that's a very good question. I haven't seen any research that really has shown the difference, because research has shown that attention or executive function does have control. They've done some brain studies and brainwave studies where it actually is showed that the attentional system can inhibit a sense and sensation coming in depending on the goal of the behavior. So, but again, also you look at the arousal system, and it's sensory diets that might help get that arousal level to an optimal state of attention, for attention to happen. So there is a crossover. I'd love to see some studies done on attention versus problems with sensory processing as far as registration. So anyway, these are great questions, because that means you guys are really paying attention to what I'm saying. I like that question. Okay. Let me see this. Okay, will we be talking more in future classes about how to distinguish sensory from attention? Well, that's a very good question. I think this could start a very good discussion with teachers, therapists. Like I said, the research isn't out there. These are very good questions to consider. I haven't seen research that really separates out the executive function of attention deficits with a sensory processing deficit. So if anyone knows of those studies, I would really love to see those, but I have not. I've looked at the research, and I have not seen any research that really pulls them apart. So this is something to really discuss, and if you're, and the whole point of this really webinar, is to say this is another tool. Don't just consider that it might be a sensory problem. Consider it also might be strictly an executive function of attention problem, or even an orienting problem, or an alert problem of attention. So there's three aspects of attention that can actually go wrong or have deficits that can affect the whole attentional system. So again, it's another tool for you guys to look at when you look at children, and why aren't they paying attention, is to really look at attention and what we mean by attention and what's going on in their environment, what's going on developmentally, where are they with their orientation, can they scan a room? So we're going to be talking a lot more about this in the application, and I think it's going to open up fun discussions. So maybe by the third time we can really have some third session, we can really have some good discussions. Okay, so are there any other questions? Oh, by the way, I want to tell you that keep your record your Stroop task someplace, your reaction times on a piece of paper, or if you printed out your notes, because that's going to be your baseline Stroop task for the next, we'll be using that information for the next series. So paste that someplace, put that someplace in your notes, because we'll be using that as a baseline. All right, so we have, okay, if it's not too late, go back to the posture. Would the COP of a young child be the reason so many kids are up on their toes? Okay, so let's talk about that. You know, again, you have the information. Let's talk about being up on their toes. So there's a lot of reason why kids might be up on their toes, but we know that little children, before their arches develop, they put their weight, their weight is thrown back on their heels. Now, think about your limits of stability in the backward sway. It's not very big. So they're really standing in their limit of stability, right? So what would be a good compensation to get themselves out of standing in their limit of stability? Pulling forward. So that may be one reason they could be up on their toes. It's just an idea, but it's something, because of this information that we've given, is something to consider. Okay, any other questions? Okay, I think that's it for tonight. I hope you were able to glean a lot of information, and I think it's going to be fun for these next two series to start really looking again at what research says about the multitasking situation. And let's see, I think Robin has the next slide. So thank you for attending, and I'm looking forward to talking to you next week.
Okay, so thank you, everyone. As you can see, the next two sessions, one on November 14th and the last one is on the 28th. There is a satisfaction, an evaluation that you have the link to, and we're very interested that you complete that. If you look down in the middle column, you can see the presentation link, and that's the evaluation for today. Those are really important for to send to the State Department, as well as our other funders. So we really need that. And then eventually what we'll do when we're all finished after the last session, in January, we'll do kind of a random sample and pick out some folks to do a follow-up to see how you implemented what you learned from Dinah's sessions, and kind of your thoughts on that. So thank you all for being on. Great job. This is the foundation that is leading up to now using and thinking about this in your work with children. So we'll look forward to seeing you next week. Thank you.